there are three significant changes that are going to affect Medicare for 2023. And in this video, I'm going to show you those so that you're prepared for them. Now, this first change that we're anticipating is going to occur for 2023 has to do with the Medicare Part B premium. As you would probably know, Medicare Part A is the inpatient side of Medicare. That's all inpatient services. And B is everything outpatient plus all doctor-related services. Now, for most people, Part A has a zero premium. And Part B is going to have a premium. Right now, this year, that's $170.10 a month. That's what we would have deducted out of our Social Security check for Part B, or they will bill you for this on a quarterly basis. All right, so I think it's important to understand exactly how Medicare determines this Part B premium. And we know that this number is established by the Medicare department. And what they do every year is they move from one year to the next, is they try to anticipate what they believe will be the overall cost to cover someone for Part B benefits. And so when they establish this Part B premium, what happens if your income, it's called modified adjusted gross income, is $91,000 as a single person or less, or a couple, $182,000 or less, then you pay that $170.10 a month for your Part B premium. And what this amount is, it's 25% of what the government estimates that it's going to cost to cover people. So you're paying 25%. The other 75% is actually coming from the Medicare budget. Now, keep in mind, if you're single and you're above $91,000, or you're a couple above $182,000, you're going to pay more for your Part B premium. Those additional amounts are called IRMAs. They're actually surcharges. That IRMA is an acronym that stands for Income-Related Monthly Adjusted Amount. I've got a lot of teaching on that that's in some of my other videos. But the point is, when they set this from 21 into 22, as they established this, they really believed that this new Alzheimer's medication called Agilum was going to be highly used. It's very expensive. So they kind of built that into the cost. Well, what happened was the manufacturer of Agilum cut it in half, and then it really is not, as so far, has been to be as effective as they thought. So they really overestimated. And so because of that overestimation, we believe that either they're going to keep the Part B premium the same, and some even believe it may come down anywhere from $8 or $10 a month. Okay, we don't know that yet. Later this year, usually around November or so, October, November, Medicare lets us know what the Part B premiums are going to be. But the point is, there really could be some kind of a change in this as they look at the cost going into 2023. Hey, just real quick before we get to the next part of the video, I just want to remind you to like, subscribe, or put a comment there in the section below and ask any questions that you would like us to address. And then just one more thing, you'll find down below in the description, there's some links there where you actually can schedule an appointment to talk to one of our Medicare guides. So if you need further advice, look at all your options, we'd be happy to help with that as well. Now that brings us to the second change that's going to occur in Medicare, and this has to do with what we call enrollment periods. Enrollment periods. Now there's a lot of confusion surrounding enrollment periods, and really the way to understand them is there's really two. Either we're enrolling into Medicare A and B, or we're buying insurance products. In other words, the government makes opportunities available for us to enroll into Medicare or buy insurance products, and that's called a period of time where we have to take action. Okay, and so what I'm going to talk about is the change that's happening to the Medicare enrollment periods as people are coming into Medicare. Not talking about insurance right now, but rather them just setting up their Medicare A and B account. Okay, so here's the way it sits today. So this would be in 2022. We have the enrollment period called an initial enrollment period. Stands for IEP. IEP for this year is this. It's always 7 months long. And so let's suppose that our birthday is in July. What happens is we have 3 months before July, okay, and we have 3 months after that we can enroll into Medicare. So if my birth month is during the month of July, I can enroll 3 months before, I can enroll my birth month, and I can enroll 3 months after. And so as the rules set now for 2022, what happens if I enroll these 3 months in advance, which of course should be April, May, and June, my Medicare is going to start in July. I'd have a July 1 effective date of A and B. But if I don't enroll until the month of July, then what's going to happen, my coverage is going to start during the month of August. So if I enroll my birth month, they actually start me the next month. But if I enroll with the July birthday and I enroll in the month of August, then they're going to skip September, and now my coverage will not begin until October. So if I wait 1 month, they put me off 2 months. But here's what happens with our present system. And again, this is going to be changed, but what happens now, if my birthday's in July and I enroll during the month of September, they skip October, they skip November, and now I don't have coverage until December. Present system, if I enroll in October, they skip November, skip December, and now I wouldn't have coverage until January. And so this is a very complicated system. If I wait 1 month, they put me off 2 months. If I wait 2 months, they put me off 3 months. And this complicated system is what they're going to change. But if you're born this year in 2022, you still have to live with these old rules. Okay, so this IEP of 7 months is going to change for 2023. All right, so now let's talk about what those changes are going to be for 2023. Again, the initial enrollment period is still only 7 months long. And keep in mind, if you have to start Medicare at 65, then this is when you need to enroll into Medicare. Now, who has to start Medicare at 65? Well, anyone that is covered by theirs or their spouse's retirement plan, anyone who's covered by their or their spouse's COBRA plan, anyone who's covered by an ACA plan, Affordable Care Act plan, you went through the healthcare exchange to get your individual coverage, you have to go on Medicare 65, or anyone that is still working and covered by a group plan of their spouses, but that group plan is 19 insureds or less. That is the group of people that has to go on Medicare at 65. Anyone on a retiree plan, a COBRA plan, an ACA plan, or in a small group plan, 19 or less insureds in the group, you have to go on Medicare at 65, and you're going to do so during this initial enrollment period. Now, keep in mind, if you or your spouse are still working, covered by a group plan of 20 or more, you don't have to take action during this initial enrollment period. You can come into Medicare at a later date, and that one is actually called the special enrollment period, and this is for people who are covered by a group plan of 20 or more. They are their spouses, and they chose to stay on that plan instead of going on Medicare at 65, and when they retire later or they terminate that group plan, then they can come in using this special enrollment period. And again, I have plenty of teaching and videos on that. So right now, we're just simply talking about using the initial enrollment period. And so how is this going to look like in 2023? Here's the changes. So let's go back to my example, and someone's going to have it. Now we're talking about July of next year. They're going to have a birthday. The 7-month IEP is still the same time period. That does not change. But here's what's going to change. So remember how we set this out? We said that if I have a birthday in April, May, or June, if I enroll during those 3 months, my Medicare will start July 1 of 2023. Okay, but here's the change. If I enroll in July, my coverage is going to start in August. But if I enroll in August, my coverage is going to start in September. And if I enroll in September, that coverage is going to start in October. So instead of them causing us to delay 1 month, 2 months, or 3 months, if we enroll our birth month thereafter during this period of time, they're going to start our coverage the next month. So this kind of craziness is making us skip 2 or 3 months if we enroll after our birth month is going away. Again, this is going to go into effect in 2023. All right. And so we still only have 7 months, but if we wait birth month on, it's just going to start. So if I enroll in October, what's going to happen? My coverage then will begin in November. And that would be the last opportunity that I'd be able to enroll during the IEP, if indeed that's when I need to start my Medicare coverage. Now that brings us to the third and final change that we're anticipating for 2023. And this has to do with what is called the general enrollment period, the general enrollment period, right? Now, as I said earlier, there's 3 different opportunities to get into Medicare. We can do what's called the initial enrollment period. This is for anyone starting at 65. We can use the special enrollment period. This is after 65 if I have been working or my spouse is working, and now we're going to come into Medicare beyond 65. And then this GEP is called the general enrollment period. And folks, the GEP really is for people who have made a mistake. In other words, they missed their IEP, they missed their SEP, and now really they're stuck coming into Medicare during this general enrollment period. Okay, so here's the way it stands right now. For 2022, this general enrollment period, if I enroll anytime between January 1 to March 31, then my coverage for Medicare begins July the 1st. and this is the system that we've used for years. Not only am I limited as to when I can enroll, just the first 3 months of the year, but my coverage has been delayed until July 1, and plus there's penalties that apply as well. Now, what's happening for 2023 is this. The general enrollment period doesn't last any longer, meaning we still only have January 1 to March 31 to enroll, but what happens, whatever month we enroll, our coverage will begin the next month. So if I enroll in January, my coverage is going to start in February. If I enroll in February, my coverage is going to start in March. And if I enroll in March, then my coverage will begin in April, okay? And then that would be the last opportunity that I'd be able to enroll during the general enrollment period. Still 3 months, but instead of them skipping to July to begin my coverage, now it's just going to start the next month. Now, keep in mind, if you're trying to come into Medicare in 22, we have to live with the old rules. But if we're going to come in 23 and we have to use this general enrollment period, then we'll start our coverage next month. Now, again, we don't really want to use a general enrollment period because not only limited, but also there's going to be penalties that apply as well. And so you need to come into Medicare using the initial enrollment period if we're going to start at 65, or the special enrollment period if you're going to work beyond 65 when you come in. There's some additional documents here that are required whenever we use the special enrollment period. So I would just tell you that your general enrollment period is something that you want to avoid, but if we can't avoid it, and that's the one that we're kind of stuck with in 2023, those rules are going to be a little bit more favorable.